Just a few moments ago, we told you about the Kids Count report that was released today, and it shows that more children in the state are living in poverty, and more of them are qualifying for food assistance. Here's some of the numbers. This is for Kent County. The number of kids living in poverty is up 25% since 2005. Almost half of all students qualified for free or reduced lunch programs in 2012. Compare that to about 88% in 2006. And the report shows a 92% increase in the number of kids living within families that have been investigated for abuse or neglect. That's between 2005 and 2012. We wanted to put these numbers in context, and we brought in Adam London, a health officer for the Kent County Health Department. Adam, thanks for joining us tonight. We appreciate it. That last stat, that 90% stat about kids living in a home where abuse or neglect has been reported, that really sticks out.
Yeah, it's concerning.
What's going on there?
Well, you know, at the health department, we don't investigate those complaints. However, we do work closely with the investigators from DHS and from Child Protective Services who do. So we're investigating that along with everyone else to find out what's at the root of that increase. You know, one thing that I think is a possibility and is concerning for us is the economic downturn and poverty. These are all connected. These are all social determinants of health. And when you go through a recession like we've gone through in the past 7 or 8 years, that's destabilizing. It's destabilizing for families in any number of ways. And could this increase in children living in questionable circumstances be part of the reason for that dramatic increase?
I think folks can make that correlation. Obviously, the recent economic conditions haven't been ideal around here, but when you look at the numbers over the last 50 or so years, these numbers haven't improved at all. Do we need a little bit more of an imperative to a moral imperative, perhaps, to look at this?
That's a great question for communities. It's something that we're looking at now, and how do we better leverage the things that we're doing? Here in West Michigan, our numbers are actually better than they are for the rest of the state. We're blessed with a lot of resources in West Michigan. We're blessed with a lot of organizations and stakeholders who are trying to make things better. And so we've been working on a number of projects to try to leverage those resources to gain better access for families and for children to the resources they need. You know, we see thousands of clients at the health department. One common theme is that these people, often those who are most needy, don't know the resources, the opportunities that are there in the community for them. So how do we build hubs of healthcare services and community resources that we can navigate these people through to get them to those opportunities and those access to the resources they need so badly?
Is it troubling to see the differences? I know you look at Kent County in particular, but there's a big difference between Muskegon County, Ottawa County, Kent County. All of these numbers fluctuate to a very wide degree. What's going on there?
That's largely demographics. You know, each county has its own unique economy, its own unique demographics and social issues. Here in Kent County, we're much more urban than Ottawa County is. Muskegon has its own social situations and issues of poverty, so it really varies based on the dynamics of that local economy.
The issues of food assistance and abuse in the home, are they two separate instances, or are we talking about something that's all intertwined?
We're really talking about something that's all intertwined and goes back to the social economic of poverty. It's such a huge determinant of public health outcomes. There are also a number of good things to look in this report. Teen pregnancy rates down 16%, infant mortality down 21%. Reading scores are up for 4th graders and for high schoolers. So there are a number of good things also, and we need to investigate what good is behind those indicators and how to build upon that.
Absolutely. Appreciate you putting this into context for us. Adam London, health officer with the Kent County Health Department. Adam, thanks.
Thank you, Brian.